Okay, we are live on YouTube instead of Facebook because of technical difficulties. But we are here, and thank you for everyone who is able to pivot and join us to get this content out to you because we have a really special guest with us today, and that is Dr. Matthew Mara, and he is a general dentist in Boston, assistant professor of dentistry at Boston University School of Dental Medicine. And also, very recently, he has joined us as a medical advisory board member of Hope for HIE to offer his expertise as a parent of a child with HIE and also as an oral health researcher. So, thank you so much for being here with us today, Matthew.
Yeah, thanks for having me.
Yeah, and thanks for your patience as we figure out all of this technical stuff. Um, the goal of today's conversation, as you know, is to talk about dental health and disparity in children with medical complexities. So you're the perfect person to talk to us today, and we can't wait to get into it. But before we do, could you please provide us with just a brief career overview, and your connection to HIE and or Hope for HIE?
Of course, yeah. So I am from Massachusetts, and I went to college and dental school in the Boston area. But between the two, I spent some time as a middle school teacher in Mississippi with Teach for America. And that education thread kind of came back at the end of my dental school experience, where I decided or was kind of to join the faculty as an option, kind of as a career path. I think if you met me 10 years ago, I would have never said that that was somewhere where I would be.
Mm-hmm.
But
Mm-hmm.
I continued kind of down the education front and have pursued some higher education within education and curriculum development as well. So I have a master's and doctorate degree in education. So my lens of a dentist is not the typical dentist, but as you maybe mentioned, I'm a general dentist. I am not a pediatric dentist. So I specialize in treating patients across the lifespan. And I was involved in a HRSA supported program where I actually ran a geriatric clinic for some years. So my interest is more in vulnerable populations than it is in specific age ranges. With that said, part of my time as a faculty member historically has been spent doing populations-based research. I teach a first year service learning class where we go to the Boston Public Schools and talk about nutrition and prevention, but also spend some time working with vulnerable populations, specifically those with or at risk for HIV and AIDS, through a variation of grants where I'm looking to kind of unsilo some elements of the dental profession by linking things such as rapid HIV testing within the dental school clinic. So kind of my previous research work really focuses a lot on accessing and finding new ways to access populations to offer services that individuals might not already need or receive. But as you, I think, kind of mentioned, and one thing that I'm so excited to be part of this medical advisory board is the birth of my daughter just about 14 months ago, maybe a little more, 14 months and 5 days. Um, Really has changed my outlook and where I want to move some of those focus and thinking about how we can change some of the my work in vulnerable populations that's been with adults or those at risk for HIV and really think more about what can we be doing for children with medical complexities. And I think
Mhm.
that's where I was really excited to partner and to find Hope for HIV as a parent of a child who was diagnosed with HIE at birth, and as someone who can really link that to some of my work in my career. So I spend 4 full days, 100% effort at the dental school, and I work in private practice in Boston as well on a day and a half a week, where again I see patients across the lifespan. So kind of every day is different. So it's always
Yeah,
interesting to describe my career because it might not exactly be what you might see when you go to your dental office to
yeah,
get your cleanings and get your checkups with your hygienist.
yeah. Well, we're so excited for your unique perspective. And this is something that this topic of disparities in dental health has been, circulating around our subgroups for a while and our community page. And it was really within the last year that we were like, we really need to build more health literacy resources around this topic because there's just not enough conversations about it. And it doesn't feel like there's a lot of research about it. So we're grateful for the work you're doing, and we're grateful for the conversations to help bridge that gap, and help equip parents with really helpful tools and information to help them navigate these circumstances that they're going through. So I guess the first question I have is not so much about dental disparity. It's more just a general conversation about just from your perspective, some of the common oral, motor, or dental issues that you see in children with medical complexities, particularly those with HIE.
So again, I'll just preface my answer with I'm not a pediatric dentist. I don't treat a lot of individuals with different complexities in my practice.
Yeah.
Although I definitely have some. I think that before I answer about children with medical complexities, it's really important to note that, dental caries or cavities, holes in teeth, are actually the most chronic childhood disease, right? Disease of childhood. So it's very common to have cavities as a kid. And the percentage in individuals who have dental decay really fall into specific classes that are broken down by socioeconomic status or racial and geographic backgrounds. So certain individuals, based on the zip code they live in or the color of their skin, may be more at risk for dental care based on their ability to access the dentist. So there's a lot of work more broadly looking at ways to increase access for dental care for at-risk kids. And those types of programs involve school-based clinics, right, where we're trying to reduce the burden of having to pull someone out to go to a dental office, transportation, locations, parking, accessibility. So there's a lot of work in the dental arena to combat the idea that early childhood caries or decay and cavities are one of the most chronic diseases in childhood. So thinking outside the box in ways that we can offer our services. So we think about ways like fluoride applications. You may or may not have received them in a pediatric appointment, which is a relatively new movement that if you go to a medical provider where they're even thinking or asking about oral health and applying fluoride treatments there as a way to help protect and mineralize our children's teeth. So before we dive deeper into medical complex children, I think it's important to ground the conversation in knowing this is a challenge for a lot of kids. And it may be even more of a challenge, and I think we're safe to say that for those who have medical complexities. When we think about all of the different services our kids within our Hope for HIE community receive, we think about those services and coming to our home and making them accessible as possible because there's so many. But when we're tacking on another provider, another appointment, an environment that might not be accommodating for all of their differences in mobility or physical and emotional needs, the dentist, it can be a scary place. And that's the same for a neurotypical child, any child that comes into our office. So I think it's important to think about that all of the challenges a neurotypical child might have, or a non-medical complex child, and maybe multiply them by a factor of who knows. And that question is really part of the reason why I think working in this environment in oral health, specifically for kids for HIE, is critically important. You mentioned there's not a ton of research, and really that's my belief too. We know that it's harder to provide care for individuals that are medically complex because of a variety of reasons.
Right.
But I think that when we are grounding this conversation and thinking about oral health in our kids with HIE, every child, whether he has some type of aversion to the dentist on the first couple of visits, every child might not like the noises and sounds that are coming from some of the machines and things that we're using. And of course, we're dressed like doctors, which has an impact on everyone across the lifespan. So we're not always the favorite person that you want to see hovering over our mouth, which is a very vulnerable area of your body when you think about it, right? It's how you eat, it's how you communicate, it's how you really feel and engage. And a lot of our kids, regardless of their ability, that's one of their most censored area of their body, right? So that's how they're exploring and learning more about their environment. So I think for me, the most common response would be that cavities
Hmm.
is the most common for any kid, specifically those for medical complexities. But there are potentially, and I think through my engagement with the Hope for HIE main page, through some of my interactions as I learn more about kids with medical complexities, to not only learn more for my daughter, but learn more from
Hmm.
where I hope to move some of my research to shed some light and better link dental care to this series of care that we receive as parents with kids with HIE to help in therapies to maximize outcomes. There's lots of, I think that the second most common would probably be an oral aversion, not letting us or accessing the mouth and thinking that we have to do everything to do a good job on the first visit. So
Right.
when we think about dental or oral motor concerns, really thinking about how we access and can we actually see what we need to in order to keep everything healthy is probably one of the top troubles. And that
Hmm.
comes down to the variety of ways our children eat, the variety of ways we may mix sugary foods with our diet, what we can and can't do. And, the parents in this group are true superheroes. They know their kids in and out better than anyone else.
Hmm.
And they know the sequence of events that they would have to do in order to get everything done. So to add dental and oral care, oral hygiene into that routine can be another burden that may disrupt a bedtime routine. It may cause an unnecessary or cause a necessary but unfortunate temper tantrum
Yeah.
or kind of heighten right before a time when you're supposed to be calming and relaxing. So I think working through oral aversions, which again can happen for any kid, but more specifically, more maybe perhaps more commonly within our population, is probably the second most thing I think about. And then, of course, there's other more medication or complex considerations that I think are worth noting. I think back to I think my 6 month neuro checkup with my daughter Vivi and my wife, and the neurologist and nurse practitioner that we were with were like, "Oh, no teeth yet," and I was like, "Well, actually, I don't think I'd expect them because the
Hmm.
medication that she was on." While it isn't the one that we learn about in dental school as the like Dilantin, the adult seizure medication, that's really the one that's causing gingival overgrowth or thickening of the
Hmm.
gums. It was my belief that that was part of the reason why we were going to have some delayed tooth eruption. And I
Hmm.
think that there is gingival overgrowth or gum overgrowth is definitely something that's likely more common for our population. But I don't know
Hmm.
if I can say that definitively because we don't really know because there isn't as much research or knowledge in that subject. And that's where a lot of these things that come through, I'm learning too through the
Yeah.
Facebook page and people's responses and why developing research and engaging in research can help overall as we start better preparing all of the providers who interact with us across our treatment for our kids so that they know a little bit more about and we have more evidence to ground practice and practice change. So I think gum overgrowth, I think about delayed tooth eruption, and also just other complexities that can come with this, as far as enamel hypoplasia, which is just less minerals in that outer layer of the tooth. I think of the tooth like a
Hmm.
hard-boiled egg. The outer layer, that shell, is the enamel, and that layer is actually the strongest material in your whole body. But the
Wow.
minerals kind of flow in and out depending on the environment inside the patient's mouth. As we eat sugary foods, the germs that live in our mouth create an acid, and it's high for a period of 20 minutes after we finish a sugary snack or drink. That acid we think of as an acid attack, which can pull or demineralize some of that outer white shell structure. Once it's made its way through that shell, the middle layer of the tooth or the white of the egg is a lot more porous. And that's when
Hmm.
cavities need to be treated right when they're at or slightly beyond that middle layer to prevent it from spreading much more quickly and getting to the yolk, that center layer or the nerve of the tooth.
Hmm.
So when I think about, you know, what we're doing, maybe kids who are receiving medication orally, maybe they're having it with a juice or a few fruit puree. It's an additional sugary insult in the mouth. And no matter what we do, when we have sugar in the mouth, we're getting that 20 minutes of acid. So as a parent tip, as you think about those late nights you're staying up or helping rock your kid to sleep, in between meals, it's always best for adults to think about water and not sipping on something like a sugary coffee through the morning. Because if you do that over the course of a few hours, right? Me too, and I'm guilty of it. But if you do that over a course of a few hours, the acid attack never stops, right? So we create that
Wow.
environment where minerals are continually lost. So I know this was a long-winded answer to one of your first questions, but I think these are things we don't know, and I think we need to explore them a little more. But I can safely postulate that there are definitely, and hypothesize that there are more oral health complexities for our population, and there's
Yeah.
more that as dental providers we can do, and inform parents that have kids with medical complexities to really help reduce the unnecessary burden and that is placed on them and their ability to access the dentist and dental care to hopefully achieve the best and ultimate health outcomes.
Yeah. And I know moving into our second question, which does cover more of the disparities and hardships when it comes to accessing equitable dental care, you talked a lot about it, like a variety of factors already. You know, it could, whether it's socioeconomic status or just where you live and just literally having to drive 1 or 2 plus hours even to access someone. What challenges do you feel children with medical complexities face when it comes to accessing dental care, and why, in your opinion, do those contribute to those disparities that you're talking
Yeah, I think that there are challenges again that the typical population faces in accessing a dentist. And it's more my work, maybe more with vulnerable populations, specifically those living with HIV. You know, it's really finding a provider that you're comfortable with, that you
about?
can share this information, and that feels more like a teammate. A lot of my work in working with these vulnerable populations, you know, my first question really is, you know, do you have a provider that you feel comfortable with? And I think when you live in different areas where maybe there's not as many dentists or states, when you're driving further, when it might be more challenging to find a dentist that is a pediatric focused dentist,
Mm-hmm.
these are all challenges that kids face. Now, on top of that, medical complex children might find challenges where does the elevator work every time we come?
Mm-hmm.
Is there a ramp to get into the room? And then, of course, dental equipment is big. It takes up a lot of space. The cords are only so long. So finding the machinery that we use in dentistry in general, that's most widely spread across all dental practices, is not designed for a kid in a wheel or an adult or
Right.
anyone with mobility issues, anyone that's significantly overweight, anyone that may have trouble in a reclined position.
Mm-hmm.
I think that these are all factors that could potentially lead to additional challenges for kids with medical complexities.
Mm-hmm.
You know, I also think it's about the parent too, right? So it's about as parents, and as a parent, from my perspective, I won't generalize, but you want to do everything you're told to do for your child. And you think more about getting it done than getting it done in a way that is the most thoughtful for the individual, your kid sitting in the chair. And
Mm-hmm.
sometimes that barrier can come with how far we push a patient in a visit and what that visit looks like.
Yeah.
My advice when I think about the challenges and just getting them in all the noise and the additional things that we just talked about that are common challenges is that we need to make this as positive an experience for any kid.
Mm-hmm.
And it's really hard to do for a kid with medical complexities that may already be anxious outside of familiar spaces, not with familiar individuals, in a room that might be hard to see a loved one when they're actually working or doing
Mm-hmm.
anything. And in an environment that is really unlike anything else, right? It's not the typical doctor's office. A lot of these practices, they're shaped in different ways. They have different types of hallways and ways to, you know, I think that these are all factors that play an important role in some of the challenges that we may get or work with kids. And then I think kind of to answer this question, the last component is more about the dental profession. So
Mm-hmm.
I think that in my understanding and in my 14 months of parenthood, you know, Vivian, my daughter, is my first child, and my child with HIE. Really, a lot of the therapies are pretty well integrated into her medical care. Everybody's asking about them. there's partnerships between all of them. They have recommendations, but really dentistry remains siloed. So I think if I was to even ask the neurologist, what dentist should I go to? She's probably going to refer hospital dentistry for me because that's probably for my daughter, because that's what she knows, right?
Yeah.
There isn't a list or providers, or I don't think there's a shared understanding across every provider, across every healthcare system, like there might be about what the work of an occupational therapist would do for their child, or what a vision therapist would maybe consider or do, or what that hearing screen looks like. So for them to describe what that dental visit would be, because they would be describing it from their perspective, which I think is not what we should be considering when we think about bringing our HIE children, our children living with HIE, to a dental provider.
Hmm.
Really, our children in general, because it should be custom tailored to their unique needs. And I think that that is one of the biggest challenges for a parent to kind of overcome, is that this may not look, we may not do everything.
Yeah.
And you know what? That's okay,
Yeah.
because having a positive and reaffirming experience is actually what's going to allow us down the road to do a better job and to let you do a better job at home in
Hmm.
assisting and helping, where this doesn't become as scary of an experience.
Hmm. So smaller goals, more manageable goals, but maybe more frequent visits to
And I
accomplish
think that
them.
that's really, I think working with a provider, that once you find one that's comfortable, you find a
Hmm.
space that works. And I think it's talking about if you're in the dental chair as a patient, talking to that provider. Do you
Yeah.
know anyone in our area? Would you be willing to try it the first time if you really like
Hmm.
that person or think that they would be really understanding?
Hmm.
I think dentistry as a profession benefits from relationships we build. We see
Hmm.
almost all of our patients at least 2 times a year, and there are very few other providers that do that apart from the therapists we may see with our kids that are on a weekly or biweekly basis, right?
Hmm.
So I always joke that for, typical healthy individual, we know them pretty well compared to even their primary care physician. So
Yeah.
I think that starting a conversation or starting there could be a really good way to find the best results for you and your kid. Because I think when you're comfortable and at ease, your vibe to your child or who you're working with, I think really plays a significant impact in that
Hmm.
interaction in a dental office. Just like it does when you're going to draw blood, or when you're going to go to PT, or you're going
Yes.
somewhere where your kid really doesn't love. Um,
Yeah.
it's all about how you frame it. And I think that that's an important part to remember.
Yeah. Um, when we talk about advocacy I'd like to start kind of like at the healthcare educational arena. And this is maybe a special question to you because you do have an education background as well. Is there a way where, or how can dental professionals be better equipped to understand or meet the unique needs of children with diverse medical conditions? And then, using that information to help foster a more inclusive approach to care. Is that something that educational institutions can play a role in your opinion?
Yeah, so this is obviously a very complex question, right?
Yeah.
So I think if we could put everybody into a meat grinder, spin it, and they all come out the same way with the same knowledge and priorities, that would be amazing, right?
Yeah.
We would be able to teach everyone exactly what we want to do. We would be able to get exactly the type of outcomes we want. But I think as a profession, dentistry needs to evolve and is evolving, but maybe isn't evolving at the same rate as some of our other health professions. When we think
Hmm.
more globally, or a larger impact, in the last 10, 20, 30 years, the world is much more, has a different approach or thought to individuals with disabilities and differing abilities.
Hmm.
And I think that in dentistry, we acknowledge that, but the traditional training models haven't found the exact recipe. And I think that's where it comes to finding an individual that you connect with is the biggest factor right now, to making sure that you're helping to, make sure that all of the outcomes are as best as we probably can have. But I do think we have to think carefully about how we train individuals and the types of programmings that we offer. Now, in the last decade or two, there's definitely been a movement within dentistry And within dental accreditation standards, our accrediting body that grants us, the ability to give these degrees to individuals to focus on interprofessional experiences. So thinking about our dental students partnering with any other health profession to help form and provide collaborative care. It's one of the hardest things for us to do in the dental school world. And it's done at such varying levels of actual integration because it is the dream hope that we would have interprofessional collaborative practice as an option, especially for children with medical complexities. I don't know how many people are listening, but there probably are very few, right? That if they have a kid with HIE, that they can go into one building for every service.
Right.
I would say probably zero, right?
Yeah.
But wouldn't that be the dream if they were all in the same area, all in the same room, using the same medical history, being able to see what happened or what happened yesterday versus what they're thinking about tomorrow, learning more about, oh, their right hand isn't the hand that they favor. So we want to think about actually having them use a different device or tool to be able to do what they're going to do as they get older to build independence. These are things you could learn if we had shared resources. So
Yeah.
I think as education and education institutions, which I know was where you grounded your question, is thinking about how those institutions can advocate for clinics and advocate for practice models that allow and afford opportunities for interdisciplinary and collaborative care into professional practice. Because that's actually what I think would be the best and biggest mover and shaker for kids in our cohort.
Yeah.
But I think it needs to start at a smaller level. And I think it's thinking about how we train providers and how we think about motivating them. So this year has been a year for me and my family, and for probably a lot of people that are listening. But one thing that's come out of it is I was asked to be a course director for the behavioral science course. And one of the final sessions, I'm partnering, and if you've watched the parent support group with Dawn Hamilton, she'll be actually speaking or doing a recording that the 214 dental students I'll teach this semester will get to learn a little bit about her experience and with Emmy and going to the orthodontist and how we interact and engage with caregivers. As someone who went through dental school less than a decade ago, I didn't have that training. My experiences, which afford me the ability, I believe, to interact with diverse populations, were outside of the dental school setting, or maybe intrinsic to my own motivation to become a practitioner. But I'm hopeful that as we think about applying theories and thinking about how we motivate, engage, and talk to patients, that we can think about customizing and working with parents and caregivers and children and adults to be able to get best and shared outcomes. So I think that's really number one, is how we train dentists and what dental schools can advocate for. And really, like, number two is thinking about how can we be collaborative. And I think from most of the dentists that have been out in the communities working for a really long time, they do what they do. They might not engage or collaborate with folks quite as much. But if you ask them to, or you talk to your provider and say, would you mind calling the dentist and talking a little bit about some of these things? I think that's how we can take what's happening in practice, because the model of changing an educational institution won't only change those who are moving forward and graduating. It won't change the 80% or much larger percent of actual full-time practicing dental providers. I think it's when they get to know you and you get to help encourage that, and then they see the benefits of talking to someone and a willingness of that partnership is really what goes a long way. And we do that within the dental practice, within the dental specialties, but we don't do it as well, despite our desire to do that in our educational training for other in other health disciplines.
Yeah. That was such a thoughtful response. Thank you. um, so as we kind of move to the next question, because we talked about, advocacy and education and the power that has in training for future dental professionals. I would like to switch gears now to talk about parental advocacy. And if in your experience or in your professional opinion, either one you want to pull from, Is there a way that parents and or caregivers are can advocate for their children to receive more equitable dental care? And do you know of any resources that are available to support them in that endeavor?
Yeah, so this is a great question. And I think I'll approach it maybe globally first and then think from a parent perspective. But
Mhm.
as a parents or caregivers of children with HIE, we have great gut instincts. I remember them telling, my daughter's particular seizures started around 20 hours of life.
Yeah.
And I was the one who kind of picked up that something wasn't going to be going wrong. We weren't in an area. And since then, everyone's always told me, you know your kid best.
Hmm.
And I think that I want to give the confidence that I've spoke to earlier. I really think of the parents in this group as superheroes in more ways than I could probably describe. Your capes are invisible, but I see them. Is thinking that you know your child best or the child you care for. So I want you to make sure that you keep that in mind as you go and interact with different providers. And I know that you already do that with those you feel more comfortable with.
Hmm.
The dentist, for some reason, seems to not be on that list. So I advocate for a couple of things. Number one, if you had a physical therapist you didn't like or didn't work with, you probably would try to switch. And I want you to do the same thing if you go somewhere and it just doesn't work out well.
Hmm.
Maybe if there isn't any actual action to try to have a better experience the second time or plan to do that, then think about exploring other options. Number two is be prepared. We're so prepared for so many other things, right? We kind of know what would happen in an OT session. We know what's going to happen when we meet with our neurologist, our regular
Hmm.
pediatrician, our feeding teams, but we don't always know what's happening. So reach in the dental office or thinking again what our experience as a patient is like and thinking that exact same thing's going to happen, which isn't always the case.
Yeah.
I think it's being forefront about it, having conversations without the child in the room, or at least creating space to do that before someone's trying to look in your child's mouth or assess and kind of get spring right to action. You should be advocating for conversations, whether that's in advance of an appointment with a provider or through written communication where you can share and pull together all of your questions. Now, to my knowledge, there isn't a great list of questions or things to consider, but I know that one of the things we'll chat about in or kind of mention is some of the work that we've been doing within the HIE community and the survey that we put out to really do an oral health needs assessment to actually get some data to support some
Hmm.
of these changes. And I think once we learn some of the challenges and we just uncover themes through the interviews that we're having or the data that's collected from the survey, we'll be better able, without my own personal bias as a parent and as a provider, to create a list or to create a list of topics that you might want to touch on depending
Hmm.
on your unique child's need in advance of that appointment. You mentioned already maybe more frequent visits. I think you should be advocating for that 100%. I think you
Hmm.
should be thinking about a stress, what we consider in dentistry as a stress reduction protocol. It's a fancy term for decide if you can come on a full stomach and come early in the day. Because we already know
Hmm.
our kids are probably going to be most compliant, most happy after a good night's sleep.
Hmm.
It means don't come directly from a therapy appointment where they've just worked really hard.
Hmm.
And it's about planning and it's not as stressful for the parent as well, so that there's
Yeah.
less of a time window or crunch that they have to get something completely finished. And I think that's also in communicating with the dental office. When is the office going to be at least capacity in case
Mm.
there is some unfortunate noises, upset kids crying to think about? And then to understand that that's part of the process for, and
Yeah.
again, a all kids, when they cry, their mouth is open so we can assess a little bit better, right? For the
Yeah.
most part.
Right.
So it's
Right.
about talking about that and figuring out ways to do
Hmm.
so. And then depending on the size of your kid, the mobility of your child,
Hmm.
I always think that even sitting in the chair, spending time going up and down, like it was one of those rides outside of a grocery store when we were kids. I don't
Yeah.
see many
I
of those
remember
anymore.
those.
Yeah.
Yeah.
Yeah. We put a quarter in and do, I
Yep.
really think and listen to the noises and touch. And every time you go, as a parent, advocating for one more sensory experience or asking, what could we do to better prepare? And maybe that's reading a book about going to the dentist.
Hmm.
I often say when we think about one thing we haven't touched on is dental sealants or ways that we can prevent cavities in permanent molar teeth, typically, is placing a little polish within those grooves. And individuals that come from different backgrounds or socioeconomic status are actually less likely to get those services, which might also be a case for our kids. And putting a little sealant there could be a really great protective way to prevent a cavity from forming in the grooves of our teeth, in areas that toothbrush bristles can't reach. But I think about like having those types of questions and learning. I say paint nails, I'd say do something. So like the sensory experience of it all isn't as much of as a shock. And before you leave an appointment, will we be doing anything different next time? Can I prepare them any differently? Is really important. Now, for those who maybe have toddlers or kids under 2 or 3, the lap to lap exam is really effective in a dental office in allowing the dentist to take a quick look at teeth. It's when the child's faced you as the parent and guardian, their legs are on either side, and you're facing the dentist. As the child reclines, their face is facing the parent. They see you. They don't see the scary person above as much that's trying to look inside. You're also able to hold them, to control their extremities and movements, and to assist. So the dentist is doing very little apart from supporting you as you support their head and control their hands and feet.
Yeah.
I think that this can be uncomfortable to do. It's hard to describe. And I would imagine that kids with medical complexities are less likely to be offered this service or this option because dentists are more worried about, can they get to that position?
Right.
But this position is something you can do at home, something you can make fun, and something you can practice so that when the environment's changed and the second person that's there is a dentist, it's not as scary for a kid.
Yeah.
So I also think for parents, as we advocate and we educate, is thinking about making this experience fun when you're not there, taking out any of your own perceptions of, oh, I don't like flossing, or I never have time for this, or this isn't fun. The dentist isn't great. Throw that away because you want to make this the coolest place for your kid. So they're excited to go. Just like what you do when you put on your grin and smile and you pull up your trousers and you go and do things that you don't want to do for yourself or for your kid to better their outcome. So I think when we think about advocating and thinking about that, I want parents to feel empowered to have those conversations. And if a dentist is not willing to have these types of conversations with you, they're probably not a good partner for your child's care. And unless you have some really concerning, that's the only place you can go for whatever other reason, I really would encourage you to think and look in for other people that may be more willing. Pediatric focused dentists are definitely more trained than a general dentist in being able to provide care, but they're not the only ones that can do visits, and they can partner with you if they're closer. If the closest pediatric dentist is 2 hours away, but you have a general dentist down the street, I think that they'd be able to help and tell you if you need to go there or when you need to go there for different services. So don't be afraid to advocate in that way too, and partner in different ways to gain more exposure. So I think kind of for me, it's look for referrals from different providers, people you feel comfortable, maybe your own personal experience, incorporating daily hygiene into your routine so it's fun and engaging, read a book, do something fun. It's also thinking about booking appointments that are setting you and your child up for success. Again, that stress reduction protocol. Consider when they're fed, if they have any gag reflexes, things like that. You know them best. I wouldn't know how they fed or what they're likely to do. And then come with a list of questions and send that list of questions or answers beforehand and have conversations. And don't be afraid of asking for someone's time, because a thoughtful and caring provider will give you what you need to make you feel as comfortable, because that's really our own goal. And I think the last piece, and that relates really to that big point, is that we're still learning. As a profession, as we just mentioned, maybe we didn't optimally train every dentist to be able to see your child and your specific needs. But every dentist knows how to tailor an appointment to work with a tooth that might be hard to access, to use a material in a different way, or to be creative in that box as they provide care to anyone. So also realize that we're learning. As a provider, I'm not perfect. As a parent, I'm not perfect. But acknowledging and accepting that and giving grace when you're able, I think is really important too. And to be able to advocate for that time and to educate will actually build a stronger bond And those are the patients that, again, some of the most challenging individuals I see are actually the ones that it really brings me reward and has gotten to me to that part of my profession. And I think that is a shared element across the board for dental professionals that's harder to tap into based on the practice and where you're going. So
Right.
remember that too, is if you approach the way that you're showing all this thoughtfulness, I think you're going to get a better result as well,
Mm-hmm.
because that's something that should really relate to a lot of the mission and vision of why these providers are in those positions.
Yeah. I mean, you listed so many wonderful tools and strategies and advice that I think is going to be really empowering for parents and hopefully alleviate some of that of their own stress when it comes to thinking about setting up a cadence of care with a dentist if they haven't done so already. You did mention very briefly a oral health needs assessment survey that you've been working on with some students. I would love for you to talk a little bit more about that and how our Hope for HIE community can partner with you in the success of that survey.
Yeah, so really the Hope for HI community has been so supportive. When I first met with Betsy, kind of thinking about, I was one of those parents in the Facebook groups that just lurked, right? I wasn't ready to share. I wanted to learn. I wanted to see what people were thinking about, but I was still in shock. I didn't know
Mm-hmm.
exactly what I wanted to do. I didn't know, we didn't, again, as your child develops, what they will need and what they will encounter and challenges that you'll face. So it wasn't until maybe she was 8 months old that I sent a message to the Hope for HIE Facebook group
Mm-hmm.
asking kind of, I see a lot of posts about dentistry. I want to do some type of research project. And from there, I've spiraled to become a member of the medical advisory board and get to do some really cool projects that I'm super excited about as I started partnering and working with different students at the dental school to give them really great research opportunities, but also to make significant impacts. So the current project that's posted on the Hope Facebook group really focuses on answering some of those what's that we don't know because there's very few information or very little information, specifically to folks that are that have any type of brain injury. And what that means for their oral health and what it means to access. So there are questions on this survey, and for those of you who have taken it, we've had over 100 responses already, which is amazing, and over 40 folks who have volunteered to participate in interviews. But it's our
Awesome.
goal to learn about what challenges and what's out there, and then also think about, we ask questions maybe specifically about demographics. So you might think, why are they asking me a question about my race, my financial status, my location, where I live, how far I am from a hospital? And that's because we put a lot of thought into this instrument to be able to better isolate some of the variables that our population faces that may be different from challenges that are known to accessing dental care that we spoke about today.
Mm-hmm.
So I want those who are responding, and thank you for those who are sharing, know that when we can isolate variables and we can really extrapolate our data really clearly, we'll have a better understanding of what additional challenges we face so that we can create better resources. Those who jump right to resources, in my opinion, from a research background or even an educator's background, don't have the whole story, right?
Mm-hmm.
They don't know all of the detailed pieces. So that's where we're starting. And our goal for this year is to think about how we can then take this information to be able to create tailored resources for the Hope page that are about dentistry and solutions to real questions or problems that people are facing. Like I said, as a dentist, I probably don't have as much of a burden to find the right care provider for my daughter as a typical
Right.
person. But Betsy mentioned, and she says she doesn't take credit for this, but it's turning that pain to purpose. And I think this is a big part of my mission now is to help those parents who are already dealing with so many things that they weren't expecting to then find ways and to provide that insight to really make a difference. And that's, I think, what for them in their child's care and to reduce those potential burdens that are on our population of those or those with medical complexities. And I think as an organization, we can really be a model for other patient advocacy nonprofits for other conditions that may also see a similar oral health discrepancy as far as the type of care that they receive overall and their oral care and their dental care and the services that are offered to them for whatever reason um, as well. And I'm excited about making that change and being a part
Yeah.
of it and being a part of that group and to be so supportive. I think we did partner with the medical advisory board in advance of sending this out. So, this is something that we'll learn a lot for and can use this information in other projects too, that I think would be really helpful for us and for our community.
Yeah. And for those of you who have not seen that link or don't know where to access it, it has been posted on our Instagram. It has been posted on our Facebook channels. And then in addition to our website, and I will even link it on YouTube as well. So, and the blog that I create from the session. So it will be readily available for you if you don't know where to look. So our last question, and it's more of just if we love to ask our providers, are there any resources that you would recommend to parents that either help with learning more about just engaging in healthy dental care practices at home, or B, just learning more about equitable access to care or the dental disparities and advocacy?
Yeah, there are a lot of really great resources out there. And I think one thing that I've learned as a parent is that some of the resources that are best are the ones that give you little bites, right? So
Yeah.
I often refer any parent to the dentist mom Instagram page. She's a pediatric dentist. She has a kid. She has little tidbits of how she does things. And I think you'd be surprised looking at it and seeing, this is how she's doing something at home. This isn't that hard. This isn't that challenging. This is great pieces of information. I think for us in our population, we can think about how we'd adapt those, but we're pro adapters, right? So I think when you have the knowledge, that's a great place to get little bite-sized pieces of information, especially if you don't have access to pediatric dentists or things like that. And she's very interactive. So if you send a message asking for something, she might consider doing her next post about it.
Yeah.
Now, from an organizational perspective, I think looking at the American Academy of Pediatric Dentistry and their website, they have a list of FAQs, which can be really helpful. So on those, they ask questions about how often should I brush my teeth? When should I integrate fluoride? What's flossing look like? What am I, how do cavities form? What is a cavity? How does this bite affect things? There's lots of different questions that I think would be a great place to check out because that's really the practice guidelines that pediatric dentists would engage by is through that particular organization. And then lastly, believe it or not, the CDC has some really great information about oral health disparities. They do a lot of work through the NIDCR, which is the oral health kind of focused CDC group. A lot of the research that happens in the office that I work at the dental school and across dental public health across the nation really is funded through that organization. And they do a great job highlighting some of the different disparities and different things that are going on within our communities to better understand those, again, access to burden or access to care burdens and ways and initiatives that we're doing to kind of reduce that as much as we can. To learn a little bit more about how that is kind of an undue or unfair burden for a lot of populations. And it's a great place to check out to learn more.
Awesome. Well, I think that this video alone is just a wonderful resource. And we're so grateful, as I said before, for your very thoughtful responses. And we can't wait to kind of hear and learn more, especially as you start to interview and get more information from that needs assessment survey. And we just can't wait to see what comes from that. Thank you so much again for your time and for your patience with the technical stuff at the beginning. And we can't wait to hear more from you as time progresses.
Yeah, I'm really excited that I could be here in Child Oral Health Awareness Month, right? And to think about all of the great things that are happening. So appreciate all of your work, and we look forward to sharing it and kind of thinking about where we'll go with next steps.